This is a case of a 31-year-old male patient presenting with 3-day history of right iliac fossa pain, Rovsing's sign positive and feeling feverish with raised inflammatory markers, and the query from the clinician was appendicitis. So a CT scan of the abdomen and pelvis was done. There was nothing significant from the upper abdomen and the retroperitoneum and the lung bases, and as we scroll down the images we will concentrate to the right iliac fossa. Here is the ascending colon, the cecum, the ileocecal valve and the terminal ileum, and as we go down we can see the appendix. The appendix is here. Once again, a little slower, we can see this tubular structure. Here it is, here, and here it is its base in the cecum. The appendix itself does not look normal. It is mildly to moderately dilated, and there is thickening of its wall along its length, and there is some fat stranding in this region. Another finding is that there is some free fluid in the pelvis, reactive fluid in this region. As for the fat stranding, it is more prominent around the cecum, particularly in the posterior and lateral aspect of it. Here we can see in sagittal view the right colon, the cecum, and there is fat stranding in this area around the cecal pole, and the fat stranding is extended between the cecum and the right psoas muscle. A few lymph nodes like these are mildly prominent, and the terminal ileum, here is the ileocecal valve, the terminal ileum is not absolutely normal. There is mild dilatation and there is a degree of fecalization. There are some gas bubbles here. This could be indicative of mild outflow reduction, probably due to some edema in the ileocecal valve. According to the findings, the diagnosis is more likely Typhlitis rather than appendicitis. However, appendicitis potentially can be developed secondary due to edema around the base of the appendix, which can cause obstruction. It is worth to note that there are some diverticula in the large bowel, and some of them are located in the right colon, as you can see here. But there is no evidence of established diverticulitis. There is moderate fecal loading of the large bowel, particularly of the right colon, but it is not significantly dilated. Here is the terminal ileum in coronal view. We can see it better. And here is the appendix. It is quite elongated. It is long appendix, as you can see. There are some inflammatory changes, and I believe that these are secondary, as I described previously. Dear friends, if you like this video, please put your comments, and you can subscribe to my channel. Thank you for watching this video, and see you the next time.